Welcome to the Marketing Stir podcast by Stirista, where we chat with industry leaders and get their take on the challenges facing the market. And maybe we'll have a little fun along the way.
On this week's episode of the Marketing Stir, Mike Kuhn from Johnson & Johnson joins Vincent to discuss the unique nuances of selling MedTech to surgeons and hospitals.
Hello, ladies and gentlemen, and welcome to another episode of the Marketing Stir. I am your host, Vincent Petrofessa, the Vice President of B2B Products and Partnerships here at Stirista. I am riding solo today. I don't have my co-host, the amazing AJ Gupta, our CEO. He is out at a conference doing some great things, but I am here with you, ladies and gentlemen. It is so good to be here. Let's talk about Stirista for just a moment. We are a marketing technology company. We own our own business-to-business data, business-to-consumer data. We help companies access that data to help them get new customers. Isn't that great? Email me, vincent@stirista.com. That is how confident I am. I just gave you my email address. And boy, are you using it. Not always for what I intend, but it's okay. That means you're listening one way or another. Anyway, we have a great show for you today. This is the type of guy I would meet at the cocktail hour at a conference. We just start talking, but he is from Johnson & Johnson MedTech. We're going to get into it because Johnson & Johnson, so many people know it for different reasons. We're going to get into his line of work. Ladies and gentlemen, the Director, Global Marketing, Johnson & Johnson MedTech, Mike Kuhn. What's going on, Mike?
Hey, thanks for having me. You know, it's funny you say that you feel like you know me. I don't know if that's a good thing or bad thing, but that probably says enough in and of itself.
Exactly, because you're a Northeasterner, right? You're that's where most of your time is, and that's why I always feel that connection. Unless I'm wrong.
A lot of fast talking, a lot of interrupting. You know, expect a lot of that. I'm assuming on this. Look, I'm from Jersey, so I got that New York in me. North Jersey. I'm up in Boston now, so it's no different in that sense. And like I said, it's funny communicating with the Northeast people, virtually, because it's a lot of hand motions, a lot of things that get lost in translation just because of the technology. So
exactly, that's what I tell my co-host, the CEO. He's from San Antonio, Texas. He doesn't get it. He's like, "How'd you know that person was from?" I'm like, even before they say it, this is what we know. It's a vibe.
Yeah,
like Texas is a vibe too, a different vibe, a different vibe, but hey, a vibe nonetheless. But Mike, talk to us about when a lot of people think of Johnson & Johnson, right, they think of those amazing products growing up, right? A staple, the different children's products, right? But you are in a different division, which also people know for a lot of great reasons. But tell us about your role specifically in that area of Johnson & Johnson that people might not know of.
Yeah, I work specifically for a company called the Kuhn, which is an orthopedics company within Johnson & Johnson. And by ourselves, we're a $10 billion revenue business unit. Okay. And so within the Kuhn, I specifically focus on our robotics programs for orthopedic surgery, most specifically spine surgery. So, it's one of those funny things, over the years, working at J&J, you say, hey, I work in orthopedics, and people almost don't even know that exists. But yet J&J owns the largest orthopedics company in the world. And so it's one of those funny discussions I'm always having where it's like, hey, I'm not doing the Tylenol, I'm not doing the pharmaceuticals. It's a whole different world. And you meet a lot of people who actually have, a knee replacement that was done, by J&J or something like that. So very different part of the business, but it's a company that's been great to work for, and a lot of really good experience that I've gotten in my time here.
Yeah, I remember you and I talking about it, and it's so fascinating because you don't think that, but you're like, oh, it's a $10 billion company, and it's huge piece of the business, and you don't think about it unless someone gets hurt and you need this solution, right? But the marketing aspect of it, this being the Marketing Stir, tell us a few things. A, how you first got started in marketing, and then also, how does one market this service? Who are you marketing this to?
Yeah, it's interesting, right? It's, I started off as a sales guy. I grew up in sales, and, my first job, I was knocking on doors in New York City, selling ultrasound systems and diagnostic testing equipment, pretty, school of hard knocks in a lot of ways. But I then transitioned to a robotic spine company called Mazor Robotics. And they were based out of Israel. And that was really the birth of robotic surgery when it came to the spine, at least. We were successful, and then we exited to a company called Medtronic, which is really the biggest MedTech company in the world. But again, a sales experience, a sales background. But what that allowed me to do is spend a lot of time in the OR, spending time with the customers, understanding how the procedures are actually working, where the bullets are really flying. At the time, a lot of these systems were new too. So really working through problems from a technical perspective, understanding, how to launch a technology that no one's ever heard of from a brand name perspective or even from a category perspective. But that all led me to J&J because at the time, J&J was in their infancy for robotics and they recruited me. And so, but it was in a marketing position. And so that first role for me as I joined J&J later in my career was as a product marketer. The interesting thing about being at Johnson & Johnson in particular is that a lot of the marketers in DePuy-Synthes, you may be labeled as a marketer, but you're really a general manager. So what it allows me to do is see everything end to end, from what we're going to do in a business development perspective, how I'm going to think about developing product, everything down to still spending time with customers, still being in the lab on cadavers and understanding how products work and going to interact with anatomy. So somewhere in between there, you find the real marketing work. And so that's something that we'll also kind of dig into, but it's just an interesting, fascinating way to think about product development, customers, solving real problems. And at the end of the day, you're not selling to consumers, you're selling to the hospitals and the surgeons. There's a whole different way to think about marketing and what you can do and what you can't do from a regulatory perspective. So very fascinating, but very different from the traditional marketing path as well.
Yeah, it is. And you think about that surgeons, they're the decision makers on what like a hospital would take in. That's so interesting. So how did being in sales at first help you become a better marketer?
The first thing I think about with even being in sales and marketing in MedTech that makes it unique is that it attracts people that have a purpose, right? And attracts leaders who want to be purpose driven. Because at the end of the day, everything you're doing, it still is about a patient and a real life that's on the table, right? And so I think finding that partnership with the surgeon and that relationship and understanding how you help them solve their problems is kind of one of the key things that you have to do as someone that's in the operating room as a salesperson, right? It's still all about problems and helping your customers solve it. I always use the mantra, people hate to be sold, but they love to buy, right? It's really about understanding, why do you use what you use? Why are you doing the technique that you do? So as I became a marketer over time, right, and I had this desk job. I'd never worked at a desk before, and fast forward to today, I was able to really apply those insights. And so I think, again, where sales and marketing becomes incredibly powerful in the med tech space is that you're so ingrained in what's going on in the operating room on the downstream relative to the upstream, right? So again, me being able to transition into the upstream and take all those lessons learned and understand what's really happening. Now that I work with R&D as much as I do, now that I'm working with the regulatory teams, and I have such a deeper appreciation for the problems that we do need to solve. And it all really comes together in a nice way in terms of how we develop products, then also how we market those problems to your customers in a way that they can digest.
No, it's very interesting because it's not you're marketing a pair of jeans. No, this is a product that could assist with helping someone in some very, very serious situations, right? And knock on wood, I've never had a surgery, that involved something like this, but and maybe without getting too technical for myself or the listeners, but the robot, you're talking about robotics, like what exactly is it? Is this different from when someone tears an ACL or breaks a bone? Like, can you like layman's terms for someone like me, just some of the differences like in this particular product?
Sure. So yeah, so the big thing to know is there's a lot of different types of robots, right? There's robots that do soft tissue surgery and they'll help remove a gallbladder or help you manage, prostate cancer and do removals. When you get into orthopedics, though, we call it hard tissue robotics. So there's robots that help you do a knee replacement. And what they'll do is they'll actually help you guide and make the cuts for where you're going to place the implant. So you can be more precise when you're trying to help balance a knee. In spine surgery, where I work, it's about helping place implants accurately, right? Because there's such small room for error in the spine that having a guidance system to help you do the surgery and place the implants with precision is really what these robots do. I mean, at the end of the day, the surgeons are always doing the surgeries in all of these instances. The robots are really working with them and helping guide them in the safest way possible to make sure that these things are placed where they need to, be it a knee, be it a screw, whatever that is. there's, so like I said, there's different applications for the different pathologies. And our particular system, like I said, focuses on spine and placing spinal hardware.
Wow, that's, yeah, extremely important. So, Mike, you and I chatted before because there's that delicate balance. I know some of the great work that your company and your team are doing, balancing sales of the products and solutions, but also balancing with areas in need that need some of these robots. How are you doing that? What's the balance there? I know you're doing a lot of great work with getting these robots into areas of need. Tell us a little bit about that work.
Yeah, there's always more, right? There's always more to do. There's always a gap to fill. And I mean, even when you think about what technology can do today, is it really treating the most complicated surgeries, or is it only treating the ones that are easy? And so when I think about places that you can expand to, be it a different country or different part of the market, it's still problem driven, right? And again, if you're going to go outside the country, the problems are different. There's people that have different pathologies. There's people that have, or hospitals that have different pricing pressures and regulatory environments. And so I think the big lesson learned from a marketing perspective is you have to constantly be on your feet and able to adapt to what those environments are going to be. Sometimes we need to, create a product that can actually serve a unique, again, pathology in a market that we don't typically treat today, right? You think about something like the cervical spine. Imagine getting a spine surgery and placing hardware, in your neck, right? That's a little bit of a tough danger zone, right? And so, how do we create products that ultimately can serve those markets in a way that your competitors can't, and meet those niches? And we've gotten to the point now where ultimately we do need to kind of niche down and find where those new pathologies are, because the market is getting more saturated with different systems and different opportunities to solve those problems. And so for us, that's where the marketing really does become important, right? So you create a great product, you have great people, but now how are you positioning it and really selling that vision, or helping your customer buy the problem that you're ultimately solving. So like I said, it goes pretty layered in terms of where you're going to be and what markets you're going after, and again, the intensity of what some of these situations might be depending on the part of the world you're in.
Is there a challenge that you face sometimes because of such a name like J&J, where you almost have to like remind them that, hey, we're in this space too. We because a lot of, under that umbrella, there's a lot of different pieces. Is there any challenges there with that brand awareness, or no, you have that pretty locked in, and just people who may not know you're in that field, it's kind of understood.
Yeah, no, I look, because it goes back to when I was at Medtronic, J&J. I mean, these are companies that, in these spaces are incredibly well known. They do all the right things. We're very compliant with how we think about, treating patients and going to doctors. I'd say that the bigger challenge is actually when I was at this Mazor robotics company, which you have this robot that no one's ever heard of or used, and you have this company that no one's ever heard of. And so the combination of the two is super interesting, because you're really creating a new field of robotic surgery. And so what I've learned is that in that instance, the category is more important than the brand. Because again, no one knows what Mazor Robotics is, but they do know what a robot is, and how do I apply that to spine surgery. And so again, there's always just a balance. Granted, I was in my sales days at that time, but it still comes back to, I mean, I think when you think about surgeons, and in my world, orthopedic surgeons, they're very dependent on their rep. They're very dependent on what's reliable. And so I think when it comes to a company like a Johnson and Johnson or a Medtronic or a Stryker, there's a lot of examples. I think that inherent belief in quality is there. It's a matter of, okay, what does my rep bring into the table? What type of relationship do I have with them? What's the difference between that implant and this implant? Because they're very close, right? So there's a lot of nuance in a bit of a knife fight in terms of, winning that business and getting a customer over the edge when your products are also similar.
Mike, because you're in a field that doesn't really rely on a maybe traditional marketing, in the sense, like, you're not putting up billboards, right? But you're meeting with specific, hospitals and physicians and surgeons. What is that process? Are you going to trade shows? Are you categorizing that, hey, these are the doctors that this person's supposed to meet with? Like, what is that system?
Yeah, channel management in our world is so critical, right? We certainly go to trade shows, and there's only so many a year. And, attendance tends to be, up and down, and you're not going to win a ton of business at a trade show, but it's something that you got to be at and show up to, right? The channel that's the most important in our world is our reps, right? I mentioned earlier that I was a rep myself, right? But the rep that's in the room with the surgeon is really the lifeblood to everything that happens. Think of them like a caddy to a great golfer, right? That's the type of relationship that they're going to have with their surgeons a lot of times. And so at the end of the day, I would challenge you, if you really want to get Tiger Woods to try a new club, you're better off getting to his caddy first, right? Because he's the one who's advising him on what to use. And so that channel for us, we obviously have hundreds of reps around the country, as every company does, is one of the more meaningful, things that you need to consider in terms of how you're going to show up, because you can have the greatest marketing campaign and it'll make an impact. You can have a lot of data. You can have all the white papers to prove out your product works. But at the end of the day, it's got to go through that rep before it really gets to that customer. And that's an important thing that you need to manage. And it can be a delicate one at times.
So, Mike, when you say in the room, are you talking about that rep is just in the room pitching and the marketing stuff, or they're in the OR?
No, they're in the OR. Like I said, they're the golf caddy standing over the surgeon's shoulder, making sure they have all the things they need. Again, from a product perspective, they're very much relied upon to that team, and they really are a lot of times a part of the team in the OR. So yeah, they play a critical role, and they're our most important channel.
That's crazy. Yeah, I mean, you have to have a stomach for it too. That's crazy. Well, yeah, there's no better way than to see if your product is working and have guidance, but someone literally in the room. That's
Absolutely.
that's
Yeah.
amazing. So, how do you market a product that requires, like, it's kind of a change in surgical behavior? It's like, rather than like a simple upgrade of tools, this is like using something that's very different, and not every hospital has this, I would imagine.
Correct. Yeah. Look, I think habits and behaviors and techniques are big to any surgeon. I would assume, particularly in orthopedics, where it is very technique driven. You have a lot of surgeons who've done something 10,000 times, and not only have they done it 10,000 times, but they've done it on a live person, right? So to break that habit is incredibly challenging, right? So a lot of times, if you're going to do that, you need to have a product that really solves a unique need, and it needs to be backed up by data. And so I think a lot of what we do from a call it pipeline perspective is, you certainly have your marketing, plan and your go to market, and you're working with that caddy that we spoke about, but they do need to get hands on. They do need to experience it. So from a customer acquisition perspective, it's very different, right? This isn't a consumer who sees an advertisement on the Super Bowl and goes and buys the product in the store. A lot of times you're going to have to get a surgeon in a cadaveric setting to work with your product and to really start to understand how it, and then there's a bit of a building of trust that has to happen there, right? So it's a very process oriented system. It starts with a great sort of product that you're marketing with a problem. You got to get it through that channel, and ultimately you got to get it hands on. And so it's not as easy as, hey, I saw a commercial for a new knee robot on TV. I'm going to buy one. Your customers might ask you about it from the customers, like their patients. But that's about it. And so again, very process oriented in terms of how you actually put this in the customer's hands. And again, it needs to be safe at the end of the day. That is the biggest thing, right? So that trust factor, that data, all that proof, the education that goes into it, it's a pretty big lift. It's a pretty big lift.
Is it at the surgeon level where he or she, same hospital, someone may be using your product and someone may be using another, or it's the surgeons who kind of influence the hospital and the hospital implements all of the equipment?
Yeah, it depends, right? We always say you need really strong surgeon champions to be bought in, right? You can't just go to a hospital administration and say, hey, we want to get a bunch of robots in your hospital. I mean, if the surgeons don't want the tech, it's going to be sitting there. It's not good for the P&L, right? It's a big, ultimately it trickles down to just becoming very, expensive healthcare costs. So you have to have that buy-in. And so, from an influence perspective, the surgeon's going to have to be the one to ultimately go to bat for this thing. So, again, when we market it, it's very much to the surgeon, but there's also that hospital aspect where, they're going to want to understand what's the return on this investment. Is this a worthwhile thing to do? And so you have to kind of play a little bit of a matchmaker in terms of find the places where it does make sense financially, build out the right pro forma, have the clinical champion, talk to the hospital CEO. Listen, these are multi-million-dollar systems depending on, what company you work for and what type of system you have. This is an investment, right? And so there's a lot of due diligence that goes into it. It's not just clinical, but that clinical champion, that clinical anchor, the surgeon, is going to be the most important person in that process at the end of the day, because if they don't want it, it doesn't matter, right? They're going to have to believe that this is safer and better for their patients. And if they do, you got a long runway and an opportunity to maybe put it in their hands.
No, it's very interesting. Yeah, because it's different than like, oh, this pair of pliers is just sitting around there. If this contractor uses it, no, this is a surgeon and he or she has to use it. But also, yeah, it's got to be worthwhile for the hospital, because going into a surgery, you're like, oh, hey, I remember a different topic when I hurt like my foot. It was just plantar fasciitis because I'm getting old. And something happened.
Yeah.
And I was like, hey, did you have this laser? I was specifically looking for a place that had this laser. So it's probably the same thing where, hey, you want to go to a place that has this particular robotics there.
Well, I'll tell you what, it's interesting. Have you had anybody on the podcast that's from like an enterprise software background or that type of thing? I always find their sales process and their marketing process super interesting, because I think they're able to kind of market this in these very broad ways where consumers can kind of see things, even though it might be an enterprise software. But at the end of the day, they'll have like 8 different salespeople or different points of contact for the different stakeholders in whichever enterprise that they're trying to sell the software to. And so it's not quite that. It's less layered, but it is very similar where like there's a lot of stakeholders that get involved in this. And at the end of the day, this is going to be a piece of equipment that's going to impact the hospital in a substantial way, similar to maybe how like a CRM would or whatever in the software world. So a lot of parallels, not as quite complicated, I think, but definitely a process.
Yeah, because it's a capital investment as opposed to like a luxury item, right? And then that's how you have to market it or present it. So no, it's very interesting. And no, we've had a lot of SaaS companies on. We haven't had a company on or a person like you, Mike. So that's what makes this a special podcast. The marketing aspect, when you're hiring marketing people, are you looking for like a technical background? Are you looking for someone in marketing? Does it help that they were once in the OR, right? Literally in the OR doing something like this? What's kind of your process for hiring?
Yeah, it's a great question. Hiring, look, I think first and foremost, I value, people that are productive, right? So I want to know what you've done. I want to know what drives you. I want to see what you've produced in the past. If it comes from the OR, that's great, because you're going to come with a really good set of skills that we can use, and you're going to really understand the customer. If you're coming from a more traditional marketing background or technical background, also critically important, because you're going to have a lot of those basic fundamentals of marketing, understanding segmentation and targeting and the 3 Ps and the whole 9 yards, right? All the fun stuff. You don't find a lot of people that have both, right? Unless they've really kind of gone through, maybe 10 years of part in sales, part in marketing. And so, look, I try to find good people, and I try to ultimately mix it up. And we do have a bit of both. I do think, for me personally, and I'm biased, I do like people with a bit of that sales background who are open to learning. They're good. They have a vision. They're purpose driven, like I mentioned earlier, right? That's always an important thing, because you go on these long, 100-mile marches with these products. It can take 3-4 years to get products out the door sometimes because of the regulatory and the design. So you need people that are really kind of looking at that North Star. But yeah, like I said, I try to find A players regardless. In terms of where you are and what your background is, isn't always super important. I wanted to know that you're productive and you got a good head on your shoulders, and typically we can make it work.
Yeah, no, I like that aspect you mentioned of the sales background, especially in your line of work, because some of those people who were in sales were in that room pitching the product and, making that jump over.
I will say this though, right? When you get internal, because in the medical device world, a lot of quote unquote marketing is product marketing. You're working with R&D. Okay. Taking your salesperson that, played college across and throwing them in with a bunch of R&D folks on day one is usually an interesting culture shock, right? Mm-hmm. So like finding the people that know how to mesh, I think is a bit of an art. And it's a fun one though, because we're surrounded by such incredible people on both sides of the aisle, the commercial and the upstream. And that there's, a lot of opinions, there's a lot of wrong opinions, there's a lot of right opinions, but you got to find people that can work together well and understand how to kind of mesh with people that really don't come from their walk of life.
Yeah, no, it's very interesting. It's no, I like that answer. Now we're going to get into the personal side, Mike, get to know you better. We have our LinkedIn question we ask all of our guests. But before I get to that, have you ever had a surgery, orthopedic surgery?
I have. I've had 2. I've
Oh,
had,
wow.
I was a college football player. So I've had a couple of labrums done on my left surgery or my left shoulder.
Oh,
So,
wow.
anyone out there that's having shoulder problems, don't get a labrum surgery. It's terrible. It's a terrible recovery for like a 15-minute surgery. I don't know how long it is, but it's a quick, for a sports surgeon, it's a pretty quick case. But yeah, it's a tough recovery. So I've gone through that a couple times. Not with a robot, though. Not with a robot.
No, see, might have been different, ladies and gentlemen. Mike, so talk to us about, we have a LinkedIn question we ask all of our guests. You're at a company like that, you will have a title that people want to talk to. What's a message on LinkedIn that, gets your attention? And what is one that you just don't like, that you hate?
Yeah, that's a good question. I'm not all over my LinkedIn. I think it's an incredibly useful tool. I use it with some frequency. I'll check it. But I'm not posting a lot. I'm not this and that and the other. I think, if you're going to reach out to me, just be authentic. So it kind of goes both ways. To what I don't like and what I do like, send me a personal note about wanting to connect. I'm open to that. If I get a generic in mail with, some copy and pasted thing and my name's spelled wrong and my name's Mike, so it's not that hard to spell, uh, probably not going to want to engage, right? So look, it's all about the personal touch. And I think, we use these tools like LinkedIn are such incredible ways to connect, but the key word is connect, right? Not to throw a broad net to just, have a base of people that I follow and I know none of them, right? So I want to get to know people. And so if you want to get to know me, like that's the best way to do it. Just be authentic.
Yeah, no, I like it. Yeah, if you're getting Mike wrong, forget it. That's
Yeah.
that's not great. I've been using a tool now where in my title on LinkedIn, I have "and funnier co-host of the Marketing Stir,"
But
right?
those little authentic things, it goes a long way.
Yeah. But if people mention like, hey, this and that, but I also know if someone, Mike, says, "Hi, Vincent, I see that you're the boo, 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 boo," and they have that in my title, I was like, "Oh, you just copy and pasted that. That was a
Exactly.
trick. That was a
Exactly.
trick." But if they say like, "Hey, you are the funnier co-host," which everybody knows I am,
Yeah.
that's kind of the I use that. So
That's good. That's a
that,
good. It's like a
yeah,
little CIA test that you use on
yeah,
people.
little trap right there. But
Yeah. Well, your
and
secret's
so
out now, unfortunately. So
yeah, yeah, exactly. Oh, yeah, I know, right? Now they'll well, good. I want people to learn
well,
about
don't
this.
worry.
No,
Everyone stopped listening once I got introduced. So no one's made it this
I
far.
know.
That's the good
Like
part.
they're like, "What am I even listening to? I fell asleep working out to this. What are you?"
Yeah.
That's
Yeah.
what people say. So, Mike, talk to us about what you like to do for fun. What's hobbies on the weekend? What are you into? You still a big football fan? Who's your team?
Yeah, well, fortunately, unfortunately, I'm still a New York Giants fan. So we just hired John Harbaugh. We got some leadership in the building. Yep. So that's good. Our franchise needs that direction. Um, yeah, but look, I got a pregnant wife. My first kid's on the way, coming in May. I got a lab puppy downstairs who I'm surprised hasn't barked at all because I'm home today. I got my hands full with just young family stuff. And so, it's funny, like I'm just seeing the hobbies slip through my fingers as the days go by. But, look, spending time with my wife and, I spend a lot of time with my family down the Jersey Shore. We go to Maine to see my family or my wife's family frequently. But it's really about outdoor activities. I work out a ton, that type of thing. So for us, anything that we can do to stay active, we're going to try to do it. And it's a little tough right now because there's about 3 feet of snow out in southern Massachusetts where I live, but we're figuring out a way to make it manage.
That's awesome. I feel your pain with the Giants. You're also going to have your hands full. I have two children of my own, and congrats to that. That's awesome. And the Jersey Shore thing, we share that in common. I go down the Jersey Shore
Where
as
do you
well.
go in the shore?
I go down to Long Beach Island, and I also go down to my in-laws, which I'll be there this Saturday, even though it's cold. My wife's like, "Why don't we go down and visit my parents?" They live in Point Pleasant now. They actually bought a
Okay,
place, and I don't really like going there because they have
smart.
three cats, and I'm allergic to cats.
Yeah,
But these are the things you do, Mike. And
my parents live in LBI right now.
oh, I love LBI.
They're
Yeah,
full time. I
it's
don't know what they're doing right now. It's good. There's no one there, but yeah, yeah, love LBI.
my advice as a new dad. Like people are like, what should I do? Day drink from now until when the baby's there, because
Yeah,
it's like remember those days where you go out, like you watch a game on like a Sunday, it's like 1 p.m. to like 5, and maybe you watch the night game. As a parent, you don't get to do that as much anymore. So I would say day drink a little bit before the baby comes.
You could move to California. That's the thing. You can move out west and they have a whole different, football
Yeah.
experience.
10 a.m. Come on. That's
Monday night football is at 3 o'clock in the afternoon or whatever it is.
Yeah.
I mean, it's a whole different, so I've always thought about that. What would it be like out in the West Coast? Would it change my family? Then I'd never watch it. I'd have a real reason to not watch the Giants. It'd be too early in the morning.
I've done that with my buddies. We go to a different Giants away game every year. That's kind of like a trip that we do. So we've experienced like Seattle a couple of years ago, and we're like, wait a minute, it is 10 a.m. and we are out drinking and stuff. So yeah, because we're away from the family. So of course we're doing that. But Mike, just a final thought you want to leave us with? Anything, advice that you received before? Anything that you want to tell people? Books you're reading, things to look out for? Just any final thoughts to our listeners?
Well, look, I think the biggest thing, I'm a big avid reader. I'm a big learner. So I'm always at that. But, I think I said it earlier. The thing that always sticks out to me when I talk to other marketers or salespeople or, anyone that feels like I can add some value, it goes back to that whole concept of people hate to be sold, but they love to buy, right? Mm-hmm. Just if you can remember that, I think marketing is all about problems. It's all about, framing those problems to people. It's not about products and features and benefits and brands. I mean, that's a big part of it. Help someone buy something in a way that's meaningful to them or something that could be meaningful to them. And if you could do that, you could do sales, you could do marketing, you could do all these different things. Particularly, again, in healthcare, where, like I said, it's a very purpose-driven space, which I'm proud to be a part of. And, that's the North Star that we always try to stick to.
That's awesome. Yeah, I love that phrase. I use that a lot too about people don't like to be sold, but they like to buy, right? And it's and also people do business with people they like, and also they're comfortable with. And I love that. No, so thanks for sharing some time with us today, Mike. This has been amazing. Keep up the great work, ladies and gentlemen. That is Mike Kuhn. He is the Director of Global Marketing at Johnson & Johnson MedTech. That's Mike. I'm Vincent. AJ is somewhere. He'll come back. We miss him. Thank you, ladies and gentlemen, for listening to the Marketing Stir. Have a great day.
Thanks for listening to the Marketing Stir podcast by Stirista. Please like and subscribe. If you're interested in being a guest on the podcast, please email us at themarketingstir@stirista.com.